Welcome to the Dog Advisory Council, a trusted resource for dog owners and enthusiasts. Today we will be talking about what should you do if your dog ate a pencil. If you've discovered that your dog has eaten a pencil, the steps you must take include taking away whatever is left and in his mouth, call the vet to ask what they recommend, and then watch for signs that your dog is struggling to digest it. Pencils are not toxic to dogs. While pencils used 100 years ago may have been dangerous if they were eaten, thanks to lead and chemical use in paint, today's pencils are very much evolved into harmless versions. Today's pencils don't use lead at all, but instead, use graphite. The paint that is used on the body of the pencil is either based on cellulose or non-toxic paint. You may also be happy to know that colored pencils and crayons won't hurt your dog either. Even though they use dyes to get their colors, they are so minimal that they won't harm your dog. The exception, of course, is if they somehow manage to eat an entire package or two. What about charcoal pencils? In huge, large quantities, charcoal can be dangerous. But, again, remember that he's only eaten a pencil. It's basically an Oreo where the charcoal is the thin creamy part and the wood is the thicker part. There is so little actual charcoal content, it isn't dangerous to your dog. Same as with a charcoal pencil, graphite is a carbon-based substance and not considered toxic unless ingested in large quantities. It is also a very low dosage even on the carbon scale. This is why it is often used in pencils these days. It's as effective in pencil form as the lead would be, but it isn't going to kill anyone. But there is a risk to dogs who eat pencils. It's the wood, rather, that can cause some problems for your snack-searching dog. Since wood is not considered an organic substance, his digestive tract will not be able to break it down like he would with his food, and it will simply make its way through his digestive tract in its form before he poops it out on the other end. However, because it just stays in its current form, pencil edges and their sharp splinters can be dangerous. These pointy edges can easily snag and cause problems in your dog's digestive tract. If they're pointy and awkward shaped enough, they could get caught in the throat and prevent food from getting past it. It can also get stuck in the tummy, or upper or lower digestive tract and create digestion issues. It all depends on how the pencil fragments spin and move in the dog's stomach. Some complications can happen, however, and some signs to watch for that your dog is struggling after eating a pencil are vomiting. If your dog vomits as soon as he eats, it's commonly because the pencil is stuck in his throat and it is blocking the food from getting down. Therefore, whatever can't do down must come up. Sometimes the retching can also loosen the pencil and cause him to spit it out as it comes up with his food. If he is vomiting, look at it closely to see if this is the case. While it's disgusting, it's certainly better than the alternative. That being said, don't ever force your dog to throw up. It could just lodge the pencil in your dog's throat even more. Unable to poop. If it's stuck in his digestive tract, it means that all of his poop and much of his pee is most likely getting stuck as well. You may notice him straining to go to the bathroom, or trying to go every 10 minutes or so. If this is the case, the pencil fragments are likely causing a problem. No appetite. A dog with a pencil stuck in his system isn't going to have much of an appetite. This is especially so if shards of it are stuck in his throat. If he won't touch even his favorite snacks or treats, it's time to take him to the vet to see what's going on. Signs of internal bleeding. In serious cases, sometimes the pencil can puncture the throat, tummy or intestine and it can cause internal bleeding. If your dog is lethargic or showing signs that he is in pain or just generally uncomfortable, this also is a sign to take him to the vet. Even if you don't see any of these symptoms, giving your vet a call is always a great idea. Sometimes they'll be able to keep an emergency slot open for you in case you need it. Sometimes they'll want you to come in when you describe the situation too. A professional's opinion can really help make a stressful situation easier. If you do decide to take him in, you'll want to make sure that you are ready for the most obvious questions. These can include information on how much of the pencil he ate, how long ago he ate it, whether he ate it whole or chewed it up into small fragments if he's eaten or used the bathroom since, and what kinds of symptoms you've been seeing. You can expect a vet to also give him a physical exam and maybe even send him for X-rays depending on what they find as well as your answers to the questions. In some cases, they'll recommend feeding your dog bread and other soft and absorbent foods. They can often soak up small of the fragments and make it easier for him to pass them. If X-rays and other checks tell your vet that he possibly has internal bleeding or a really bad blockage, surgery may be the safest and best way to keep your dog safe and healthy. This is often a personal choice, of course, but it's not recommended unless a vet feels it's in the best interest of your dog. If you want to learn how to keep your dog from eating pencils, click the link in the description below. If the information in this video was useful, please like it and don't forget to subscribe.